Hi, I'm Dr. Waldrop at Vida Integrated Health. We're here with Laura to talk about IT band syndrome or iliotibial band syndrome and how it relates to the hip. So IT band syndrome is really common among runners. It can be in any activity though. So it's marked by pain, sometimes tightness along the outside of the thigh, but especially pain around the outside of the knee. So this muscle here called the tensor fascia latae or TFL connects into that IT band, which goes down just below the knee. And when that's tight and you run or walk or whatever, there's friction there. That's what causes the pain. So we need to work on, you can lengthen this muscle and work on rolling that out, and that can help, but we really need to strengthen the hip abductors, the gluteus medius specifically. So that TFL muscle does abduct the hip or bring it out, but it also internally rotates it. So we want to work on that external rotation and abduction. There's a couple ways we can do that specifically towards running. So Laura here is going to start with the basic one, is just a clamshell. So you can relax down there. And then what I'm going to have you do is knees, ankles, and hips, knees, and ankles stacked. And then you're going to just bring this leg up just like that and slowly lower it down. Good. And this muscle here right behind that hip bone there, that's where you should feel that firing, right? Do you feel that, Laura?
Yes.
Okay. So this is something more just to kind of wake the muscle up, feel it. Pretty basic. So that's pretty easy. If that's not challenging, the next thing you want to do is a side bridge. So we're going to do a modified side bridge called a Mcgill side bridge. So you're going to come up onto that arm. That elbow's right under the armpit. Imagine there's a cactus right underneath those ribs, so you want to stay off that to keep everything engaged. So what you're going to do here, Laura, is knees are going to stay together. You're just going to push that hip up off the ground and come forward. Good, and then slowly lower back. Keep those knees together. Good. So this is the Mcgill side bridge. So the next step from this would be to add a more running specific movement. So you're going to hold that. You're going to lift this whole leg up, and you're going to take that through flexion and extension just like if you're running. And again, we want to keep that hip a little external rotation so we don't internally rotate it and get into that TFL, which can increase that tightness. So go ahead and do that a few times. And Laura's a rock star with this, so she's doing great here. All right, you can go ahead and relax, Laura. So this is three great exercises, kind of progressions to strengthen that gluteus medius. This should help. You can keep foam rolling the IT band area. Might be helpful too. If you still have pain with running and doing these exercises, just go ahead and see your provider, get it checked out, and make sure not any more care is needed.